All right, Deja. So, based off of what we talked about, you are a high school player who has a grade 2 lateral ankle sprain and possible distal fibular fracture. Um, but unfortunately, you're refusing to go to the doctor, which I understand due to the fact that your mother has cancer and your family doesn't have enough money to pay for a doctor visit or even imaging. So, I'm going to do what I can to help you progress within the next 2 weeks. And you told me that if you don't progress within the next 2 weeks, that you will try to go see a doctor. So there's two things that we're going to test to see if you're progressing, like we stated. There's a patient reported outcome and there's a clinical reported outcome. So the patient reported outcome is kind of how you feel like you're progressing within your rehab. So we're going to take one today and then you're going to take one again in 14 days. And the patient reported outcome that we're going to use is the Foot and Ankle Disability Index. There's two parts to it. There's 34 questions in total. And the two parts are the Foot and Ankle Disability Index is one, and then the Foot and Ankle Disability Index for sports is two. So with the two separate parts, the one that's just a regular index is in regards to your daily activity, going to classes, waking up in the morning, being able to do your normal day-to-day activities versus sports related is not being able to do sports, what activities you can do in sports and which ones you cannot. And so also with that, it contains 4 pain related items and 22 active related items. Um, and it also is based off a 5 point scale. So it's going to go 0 to 4. So 0 being none at all and 4 being the worst. And it is for the index itself, it's out of 104 points. And for the sports, it's out of 32 points. And based off of this test, it has a receptiveness of 0.89, which is about 89% for the index and 84% for the sport. So that means it's pretty reliable. And then for the clinically reported outcome, which I will use, is the ankle foot. It's the American Foot and Ankle Score. And for that, it is kind of a scale from 0 to 100. It's kind of giving me a percent. So if I'm going to look at your ankle, 100% range of motion versus, okay, we're about at 50%. So that's kind of what I'll be looking at is your range of motion and kind of that's how I will see if we're progressing in nature that we need to be. And so to explain what you have, so grade 2, there's 3 grades to a sprain, tear, so it's the kind of progression. So with a grade 1, it's just very minor, there's no tear at all. Grade 2 is a slight tear, and then grade 3 is a complete tear. And then it's the lateral ankle sprain. So it's the lateral side, which is the outside of your ankle. And then there's 3 ligaments that hold that together. And with those 3 ligaments, there's one that goes forward, there's one that goes down, and there's one that goes to the back. And those 3 ligaments are called the anterior talofibular, the posterior talofibular, and the calcaneal fibular ligament. So the calcaneal goes back, or calcaneal goes down, the posterior and the anterior. So the anterior talofibular ligament is the one that is very common to have a tear. So that's what I'm pretty sure you have the tear in because it's the lateral anterior ligaments. Um, so that is kind of what we will go with the grade 2 lateral ankle sprain. With a possible distal fibular fracture, so you have your fibula that runs along the outside of your leg, and the distal end is like the bony aspect that you feel on the side that kind of is prominent is what people say your ankle bone. It could have a possible fracture. A fracture is a break in a bone. And so with that, that could possibly be a surgical procedure. But we will look at that as days progress. Um, and there's a few things that I want you to be able to contribute in this. So there's 2 things. So what are your short-term goals?
My short-term goals right now would be able to walk without pain and maybe in the next couple of days be able to not have to use crutches.
Okay. And then your long-term goal?
A long-term goal would be to be able to run again.
Okay. And so we will both work together and kind of go overlap in this. So I will also give you what my goals are for you. My goals short term would be to increase your range of motion. So right now you're not able to do the same thing that you're all able to do on both sides of your feet. So being able to have full range of motion. So dorsiflexion, plantar flexion, inversion, eversion. So that's one of my short term goals. Also to reduce your swelling and your edema. So the coloring that's on the side of your leg, also, which is ecchymosis. I want to work on that. And then my long-term goal for you is to be able to return to physical activity. Any questions for me based off of everything that I've told you so far?
Right now, where would we go as far as rehabbing? Like, what would we go
Do
forward with?
Okay, so currently, because the injury just happened, I don't want to be like, okay, let's jump into physical activity right now and let's start doing complete rehab. But today, what I want to do is two things. I want to get you into the whirlpool, and I want to, which is submerging your foot in cold water. And there's a conductor that's in there that circulates the water, which keeps it cool the entire time. And with that, it's going to help with the swelling that you're experiencing. And then also, I want you to try to do the alphabet in there. See how you feel doing the alphabet. I want you to do at least one time, and I want you to do all the letters in capital. And I want you to go with your big toe, kind of tracing out the letters that way. And then also I want to do game ready. Game ready is a form of compression. So those are the things that I want you to remember is rest, ice, compress, and elevate and stabilize. So it's called RICES. So those are the things that we kind of use for us. And with that, I'm going to do, so you're going to rest. So you're going to elevate your foot with the game ready. That's also another part. You're going to compress it. The game ready compresses your ankle, and then it has ice in it or cold water that circulates through. So it compresses your ankle and forces the swelling out of your ankle and back into your body. Um, that's what the game ready is. And then unfortunately, I'm going to put you in a boot on and crutches right now, just because you possibly have a fracture. And with a fracture, I do not want you to weight bear at all currently. So I'm going to give you two crutches. Have you used crutches before?
Yes, I've used crutches before.
Okay, so I'm going to give you crutches and you're going to use those. And then as time progresses, we'll wean off of using two crutches to one and then no crutches at all. And then, do you have any pain medication at home?
I have a leave.
Okay, so I want you to follow the recommended on the bottle, which is normally 2 in the morning and 2 in the evening with food. And with that, I want you to be very precautious about your stomach. So if you notice any irregularities, like your stomach's not feeling well while taking it, or if you're not having regular bowels or something irregular, you're feeling nauseous, definitely stop taking the medication. And then we will kind of wean off of those, don't take those anymore, and then we'll talk about what other options you have. And the reason why I want you to take that is to help with the pain and then help with the swelling that's currently in that area. Do you have any questions for me?
No, I don't have any more questions.
All right, thanks.